How does echolalia affect kids with Tourette syndrome? Imagine hearing a child repeat words or phrases they just heard, often without meaning to do so. This involuntary repetition is called echolalia, and it can be part of Tourette syndrome. Tourette syndrome is a condition where kids have involuntary movements and sounds called tics. Echolalia is one type of vocal tic that some children with Tourette syndrome experience. It is not always present but can show up alongside other tics. Echolalia can influence how children feel and interact with others. Because it is involuntary, kids might feel frustrated or embarrassed when they repeat words unexpectedly. This can make them feel self-conscious, especially in social or school settings where fitting in is important. Kids may also feel anxious or upset if they cannot control their tics, including echolalia. The tension from trying to suppress these tics can make it harder to focus or participate in conversations. From a mental health point of view, echolalia often occurs with other conditions like attention difficulties, obsessive-compulsive behaviors, or anxiety. These overlapping issues can make emotional regulation more challenging for children. Recognizing echolalia as a tic rather than intentional speech helps reduce stigma and supports children in understanding their behaviors. It also encourages patience from family, teachers, and friends. There are tools that can help children manage echolalia and build resilience. Behavioral therapies like comprehensive behavioral intervention for tics teach children to become more aware of their tics. They also help develop strategies to reduce the frequency or impact of tics. For example, children learn to replace or redirect their vocal tics in a way that feels more manageable. Creating supportive environments at home and school is also important. Patience, understanding, and positive reinforcement help children feel accepted and confident despite their tics. In summary, echolalia in children with Tourette syndrome can affect their emotional health and social life. But with proper support, behavioral strategies, and understanding, children can learn to cope better. These tools help them manage symptoms and develop resilience, making everyday interactions easier and more positive.